Hi, Wes here from Rare Patient Voice. When we sign up patients for our panel, we ask key questions such as disease, subtype, medications or devices, demographics, severity, and when diagnosed. Usually when you have a study, you'll have much more specific screening criteria, and we'll screen the respondents accordingly. But sometimes the screening criteria are so crucial that you want to get an idea of how many we'll have before you commit to doing a full study. We can help. In this case, we do what we call a feasibility study. Just like with our handovers, we'll go out with a few key questions to the patients or caregivers of interest. We'll let them know we may have a study about this in the future. So we can go to all the panelists in a particular disease or diseases and ask these questions. For example, maybe you want a specific cystic fibrosis mutation, or only hemophilia patients with inhibitors, info that we may not have in their profiles. We can quickly send this out and get responses from most of the panelists in a couple of days. We'll provide you with the results. For example, we have 205 patients using the device of interest. If you want to proceed with the study, qual or quant, we'll proceed with a much better idea of how many may qualify. What does it cost? The cost to do a feasibility study is $250, just that setup fee. Since it's just a few screening questions, there's no honoraria or incentive processing and no recruiting fee, just a $250 setup. And the good news, if you proceed to follow it up with a qual or quant study, we take that $250 off your setup charge. So if you do the full study, the feasibility study ends up being free. Please ask any questions you have about this. We're always looking for ways to meet our clients' needs. And please, remember to subscribe to our YouTube channel. Thanks. Hey, if you like this video, subscribe to our YouTube channel. Thanks. Bye.